The nurse continence advisor assessment is an important aspect of the nurse continence advisor role. And that is why a patient would come to see me. If they were leaking urine, for example, maybe they're leaking a small amount of urine, or perhaps they're leaking the entire bladder, they're losing the whole bladder with this overwhelming urge, or they're getting up at night to pee, which is impacting their sleep and ultimately their quality of life. So I would actually ascertain all the symptoms and look at all the symptoms that they're having and do an assessment, do a limited internal examination, review the medications that they're on, because sometimes medications can actually contribute to urinary incontinence as well. You might wonder what a nurse continence advisor is. It's actually an independent practice model where we diagnose, ascertain contributing factors, and suggest recommendations, really conservative measures and management strategies for women who are experiencing urinary incontinence. It's very important that the diagnosis is made appropriately, because there are several different types of urinary incontinence diagnoses. For example, stress urinary incontinence, urge urinary incontinence, overactive bladder, neurogenic bladder. The reason the diagnosis is so important is because the diagnosis is tied to the treatment recommendations. So you'll have very different treatment recommendations in some cases, given the different diagnoses. One of the first aspects of the assessment that a nurse continence advisor would do for a woman who's leaking urine is ask her to complete a bladder diary. And that will be an account over about a 2 to 3 day period of what she's drinking, how much she's drinking, what time of day she's drinking, and also how much she's voided, when she's voided, how many times she's voided, and if and why she has leaked urine. That's a very important tool to help with the diagnosis and can have a placebo effect of about 30%. Once a woman is made aware of why she's leaking and what's contributing to that, she can often take some of the first steps herself to decreasing her urinary incontinence. So the recommendations really would be bladder health for everybody, and people are not always aware of that. So for example, fluid management. Dilute urine is less irritating to the bladder than concentrated urine. So therefore, you want to drink enough water-based fluids so that your urine is clear. A lot of people stop drinking fluid because they're afraid they're going to leak, but this is counterintuitive, and it actually make your bladder be a bit more irritated and more likely to have to go to the bathroom and or to leak. Also, bladder retraining is an important aspect of our program, and a lot of people will go to the bathroom 20, 30 times a day. And so we'll teach, as long as they have proper diagnosis of urge incontinence or overactive bladder, which is frequency, urgency, and nocturia, we would educate patients on distraction techniques and delaying going to the bathroom, and teaching them pelvic floor exercises so that they can learn the urge suppression techniques. We'll educate them about the normal amount that a bladder holds, which is 400 to 600 cc's. But a patient may be voiding small amounts, 50 cc's, 60 cc's, every half an hour, every hour, and that will really impact the quality of life. So we teach urge suppression. Distraction, standing up on the tippy toes will also help, and also squeezing your rectal muscle 10 to 15 times quickly will calm the bladder down and bide you some more time to go to the bathroom. And you want to actually get over that hump where you have that overwhelming urge to go to the bathroom. And so that strategy, squeezing your rectal muscle 10 to 15 times, will calm your bladder down. One also wants to be sure that the bowels are working appropriately, and we assess that as well. And we'll ask patients to take a look at the Bristol stool scale to describe the type of bowel movements that they are having. A lot of patients are constipated, so if you're having pellets or small round stone-looking type of bowel movements, that could be an indication that you are constipated. Also, if you're wiping yourself and there's staining on the toilet paper, you can also be constipated. That will contribute to stress urinary incontinence and overactive bladder because of the anatomic location of the rectum to the bladder. So what you want to do is, what I recommend is eat 1/3 of a cup of all bran buds, because it has 12.5 grams of psyllium fiber, which is half the daily requirement for a woman for fiber. And it'll actually help her to evacuate from the top down. You want to make sure that you're drinking your water-based fluids as well along with that. Bladder irritants are another important aspect of bladder health. So there's lots of things on the bladder irritants list which will irritate your bladder and your bowel. For example, coffee, tea, alcohol, chocolate, strawberries, citrus fruits, bubbly drinks, all contribute to irritating the bladder. It's not that you can never have any of them, but you just want to have them in moderation as well. Another reason a woman may come to see a nurse continence advisor is because she may feel a bulge in her vagina. Her bladder may have dropped, her uterus may have dropped, and this can be from a grade 1, so a small amount of bulge, to a significant bulge where everything is falling outside of her vagina. And that is called prosodentia. So one of the treatments that we utilize is a pessary, and a pessary has been around for a long time, and it's a very nice conservative measure to treat vaginal prolapse. This is a pessary. It's actually called an incontinence dish. There are a number of different types of pessaries depending on your prolapse. This one is good for women who leak urine when they sneeze or cough or run, exercise, jump on the trampoline. And this is measured, we measure you and then fit you for a particular type of pessary. After 1 to 3 tries of different types of pessaries, it works about 80% of the time. Women can care for these by themselves. We teach you to service it so you can remove it, wash it with warm water and mild soap, dry it, and reinsert it using a little bit of lubricant. This can remain in place during sexual activity, and it's a great option, especially if you're waiting to have surgery or if you do not want to have surgery for your pelvic organ prolapse.